Fluticasone is a corticosteroid indicated in the treatment of corticosteroid-responsive dermatoses, asthma, and COPD. In this video, let's found. What is fluticasone? What class of drug is fluticasone? What is fluticasone used to treat? Who cannot use fluticasone? What are the side effects of taking fluticasone? How does fluticasone make you feel? How to use fluticasone? What is fluticasone? What class of drug is fluticasone? Fluticasone is a manufactured glucocorticoid used to treat nasal symptoms. Both the esters, fluticasone propionate and fluticasone furoate, are also used as topical anti-inflammatories and inhaled corticosteroids, and are used much more commonly in comparison. It is on the World Health Organization's list of essential medicines. In 2020, it was the 23rd most commonly prescribed medication in the United States, with more than 24 million prescriptions, although it is also sold over the counter. What is fluticasone used to treat? Fluticasone's two esters are indicated as inhalers for the treatment and management of asthma by prophylaxis as well as inflammatory and pruritic dermatoses. A fluticasone propionate nasal spray is indicated for managing non-allergic rhinitis, while the fluticasone furoate nasal spray is indicated for treating season and perennial allergic rhinitis. Who cannot use fluticasone? It is contraindicated in the primary treatment of status asthmaticus or other acute episodes of asthma or COPD where intensive measures are required. Hypersensitivity to any of the ingredients of these preparations contraindicates their use. What are the side effects of taking fluticasone? Using too much of this medicine or using it for a long time may increase your risk of having adrenal gland problems. Talk to your doctor right away if you have darkening of the skin, diarrhea, dizziness, fainting, loss of appetite, mental depression, nausea, skin rash, unusual tiredness or weakness, or vomiting. Pharmacodynamics. Systemically, in vitro experiments show fluticasone furoate activates glucocorticoid receptors, inhibits nuclear factor kappa B, and inhibits lung eosinophilia in rats. Fluticasone propionate performs similar activity but is not stated to affect nuclear factor kappa B. Fluticasone propionate as a topical formulation is also associated with vasoconstriction in the skin. How does fluticasone work? Fluticasone furoate and fluticasone propionate work through an unknown mechanism to affect the action of various cell types and mediators of inflammation. In vitro experiments show fluticasone furoate activating glucocorticoid receptors, inhibiting nuclear factor kappa B, and inhibiting lung eosinophilia in rats. Fluticasone propionate performs similar activity but is not stated to affect nuclear factor kappa B. Half-life: 15.1 hours for intranasal fluticasone furoate and 24 hours for the inhaled formulation. A study of 24 healthy Caucasian males showed a half-life of 13.6 hours following intravenous administration and 17.3 to 23.9 hours following inhalation. How to use fluticasone? To use the fluticasone propionate and Veramyst nasal spray. When you use the fluticasone nasal spray for the first time, you must prime the spray. Press down fully the top of the pump 6 times or until a fine spray comes out. Prime the spray if it has not been used for more than 7 days, fluticasone propionate, or 30 days, Veramyst, or if the cap has been left off the bottle for 5 days or longer. Shake the medicine well before each use. Gently blow your nose before using the spray. Tilt your head back slightly and insert the tip of the nose piece into your nostril. Close the op nostril with a finger. Release one spray and at the same time, breathe in gently through the nostril. Hold your breath for a few seconds, then breathe out slowly through your mouth. Spray the opposite nostril using the same steps. Do not blow your nose or tip your head back after using the spray. Wipe the tip of the outside of the nose piece with a clean, dry tissue or cloth and put the cap back on. Throw this medicine away after you use 120 sprays. Are there specific concerns about triamcinolone and pregnancy? Advice and warnings for the use of triamcinolone during pregnancy. FDA pregnancy category C risk cannot be ruled out. That's all the information about fluticasone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.